All right, it's Dr. Jeffrey Gerdes here from Carolina ChiroCare and Rehab. We're here today with our patient. And tell us a little bit about why you're here. You were involved in a car accident
I was.
recently?
Yes, I have a lot of back pain and a lot of neck pain today.
Some back pain and some neck pain?
Yes.
Okay, so we're going to see if we can proceed here with the treatment and get her feeling a little bit better before she leaves today. So let's just check a couple things here. We're going to check the patient's ranges of motion in her cervical and lumbar spine. So can you turn her head to the right as far as you can? And to the left. Good. And back to center. Now, was there pain with that?
Yeah, and there is a bit of
There's some
pain.
pain, okay. And let's see, can you bring her head all the way to the left and all the way to the right? Good. And are you experiencing pain with that?
A little pain.
A little bit, okay. And can you look all the way up and all the way down? Good. Now, did that hurt your spine?
It did hurt.
Okay. Check the patient's reflexes here. Good. Good, healthy reflexes. Doesn't seem like there's anything wrong there. Okay, now let's check your low back. Are you able to bend forward as far as you can? Good. Any back pain with that?
Yes.
Good, good. And come all the way back. And does that hurt?
Yes.
It does, okay. Any pain when you twist here?
Yes.
Okay. Any back pain with that?
Yes.
That hurts too. So, as you can see, she has some normal ranges of motion. They're a little decreased, but they all do cause neck and lower back pain. So let's see, can you lay face down here on the table? Good. So we're here. Very good. You got some really long hair. We're just going to get that out of the way. Good. And you're going to feel a nice stretch here. Good. Just relax your shoulders. Very good. There we go. Good. And let's go to the other side. Good. Relax the shoulder. Down. Perfect. Good. Let's check the low back. We're going to do a couple orthopedic tests. Are you having back pain with this?
Yes.
Okay. Positive Eli's test. Back pain with this?
Yeah.
Good. Back pain there. Positive hips test. Any back pain there? And a positive Yeoman's test. Good. Does this hurt?
No.
Any pain here?
Yes.
That hurts?
Yes.
Any pain here?
Yes.
Good. So all that produces some back pain. As you can see, she has some sprained joints and ligaments in her lower back and her pelvis. And we're going to see if we can get her feeling a little better today with the treatment. Let's see, can you lay here face up on the table? Good. So just kind of feeling where the joints are restricted. Down here at C5, C6, we're going to go in, do a cervical adjustment on the neck. Drop the head. Very good. Here. Upper cervical spine, C1, C2. Great. We're now going to get the patient's upper back or thoracic spine. We're going to do an anterior adjustment, go into the joints in the mid-back, and do a chiropractic adjustment on those joints. Let's see, we're going to cross both arms. Good. Scoot down just a little here on the table. Very good. Here, just give yourself a big hug. Very good. Good. One more here. Very good, very good. And we're now going to get the low back and the pelvis. Can you lay up here on your side, face me? Let's bend this top leg here. Good. I'm going to cross both arms here. And good. Just going to stretch. Good. Very good. Let's go on the other side. Going into the patient's L5 vertebrae and her right sacroiliac joint. Good. Very good. And let's see, let's go face down. Stretch out the patient's muscles a little bit while I do some muscle work on her upper back. She's got some tight muscle spasms there, and this instrument just helps to loosen up the tight muscles. Think of it like a mini massage that we do here in the office. Patients really love it. Lumbar muscles. Still doing okay there?
Yes.
Still alive? A little tight there, does that hurt?
Yes.
Your head to the right. Good. All the way to the left. Good. Any reduction in the pain? Does it
Yes,
feel
it
a little
feels
better?
a lot better.
Okay. There you have it, folks. It's a full spine chiropractic adjustment. It's your Raleigh chiropractor, Dr. Jeffrey Gerdes here, Carolina ChiroCare and Rehab. Until next time, thanks for watching.